Hello everyone. Today we are discussing about a case, ECG case, of a 35-year-old male, type 1 diabetes. He present feeling generally unwell with abdominal pain and dyspnea. ECG is this one. So how will you diagnose the ECG? First, we should start with the rate of the ECG. That is 1500 divided by RR interval small squares. Here we should understand that the RR interval here, the big squares in RR interval is 1, 2, 3, 4, 5, 6. 6 big squares plus 2 small squares. So each big square has 5 small squares. So 30 plus 2, 32 small squares. So we should understand that it is 1500 divided by 32. The rate will become around 46 beats per minute. So it is bradycardia. The rhythm is regular here. We can find that the rhythm is regular. It's clear that the rhythm is very much regular. About the P wave. Can we find any waves of P wave here? No. So the P waves are absent. Next, we should understand the QRS complex. The QRS complex, see 1, 2, 3, more than 3 small squares. So it will be more than 120 milliseconds. So QRS complex is widened. Then about the T wave. See here the T waves are peaked, tall and tended. So tall tended P waves. Sorry, it's tall tended T waves. So these are the main findings seen in this ECG. So we can thoroughly diagnose it as a case of tall tended T waves hyperkalemia with absent or flat P wave. So tall tended P waves, we should understand that this tall tended P waves appears in two clinical conditions. That is, one is hyperkalemia and second one is acute MI. These are the two clinical conditions where we see tall tended T waves. So T waves in first hyperkalemia. How this T waves appears in hyperkalemia? We should understand that the T waves may appear in hyperkalemia as a tall tended T wave. Like we see in this ECG, these are tall tended T waves. See, tall tended T waves are seen in hyperkalemia. In acute MI, we could see it is not peaked or tended T wave, it is almost a broad T wave. We see a broad T wave in acute MI. So we should know that what all changes can we see in a case of hyperkalemia. First one is the first early change is peaked T wave. See that the P wave is peaked T wave. Second is flat P wave or completely absent. This is the P wave which is flat or completely absent. You should know that here also in this ECG, the P waves are absent and the T waves are here tended. Next, we should understand that in hyperkalemia, the P waves is absent or flat with a prolonged PR interval. The PR interval has been prolonged more than 200 milliseconds. Next, decrease R wave amplitude. Amplitude of the R wave is decreased compared to the T wave. Then wide QRS complex. Here we can also see that in this case, the QRS complex, as I said, it is more than 120 milliseconds, more than 3 small squares. Next is depressed ST segments. Here you can see that ST segment is quite depressed. So coming to hypokalemia. Hypokalemia, the slight peaking P waves are seen. The earliest change is U wave. We can see that a U wave after T wave, which is more prominent than T wave. Then we can see the inverted or flat T wave. The T waves are inverted or just flat or shallow, but the prominent wave is the U wave. There will be ST segment depression. We can see this depression and slight PR prolongation, slight peaked P wave. Peaked P wave. In hyperkalemia, the T waves are peaked. Here the P waves are peaked. That's a difference. That's a difference in case of hypokalemia. So this is case of hyperkalemia. It's clear we should understand that first we should look at the rate, rhythm, then the P waves are absent, the tall tended T waves, then the white QRS complexes. We can easily identify in the case of also the depressed axis ST segments are being shown here. So likewise we can easily diagnose hyperkalemia. Thank you so much.